the maxillary sinus is going to be there when you talk about posterior maxilla. Sometimes the maxillary sinus does the pneumatization of the anterior alveolar bone also, and it can come literally near the canine or lateral incisor also, at least up to the first premolar and canine. Now, when you are dealing in the posterior region, you should have the sound knowledge of the maxillary sinus, as well as you should know how much bone is available from the crest to the maxillary sinus. If from the crest to the maxillary sinus the available bone is 7 mm and width is sufficient, then go ahead and place an implant of length 8 mm and width you desire to place. Okay. If the length available is less than 5 mm, that time you can do some indirect sinus lift procedures, and you can push the sinus membrane inside. You can push the sinus membrane above and put a graft below the sinus membrane. So what is sinus lift? There is a membrane which is covering the sinus. So you lift this membrane, put a graft underneath this. You call it as a sinus lift procedure. Okay. So here you have, when you approach from here, either you can do a crestal approach or you can do a lateral window sinus lift approach. So when you have 5 to 6 mm bone available, then you can go from the crest. You have specialized instruments. You can lift the sinus floor, put a graft from this side only, and can place the implant simultaneously. When bone is less than 3 mm or 1 to 4 mm, that time the lateral window approach is better. So when you see the CT, you understand this. So you open it laterally without perforating the sinus membrane, lift the sinus membrane, put the graft from here till the palatal side. So the graft should be there from this buccal side to palatal side. So fill this completely. If 3 mm of residual bone is there, then you can do implant placement also at the same time, so that the healing time is reduced. Or you have to wait for a 6 month for the graft to get mature and then place the implant here.